So this just went on all night. I couldn't sleep. And this went on for days. And I'm like, this could be it. I could have some sort of nerve damage, maybe permanent nerve damage, where I'm not going to be able to ever sleep again. You know, I'm going to be some insomniac.
Hey y'all, it's Donna. I saw this on Freelee's channel and I had to talk about it. She went in for a deep cleaning, which is something that I've never in my life heard of. I've never heard of them numbing your whole mouth just to clean your teeth. And so I looked it up because a routine cleaning, they just kind of scrape the teeth and the plaque off of it and, rinse it and brush it. But it says here, the deep cleaning, it removes bacterial from diseased gum tissue. So you've already got either gingivitis or you're well on your way. So her mouth must have been really, really bad. Because the routine cleaning, which is the only thing I've ever heard of, that's what protects you from getting to that point, or just keeping your mouth clean in general. And a routine cleaning does not require any anesthesia or anything, because they just, like I said, they clean the teeth and everything, and it doesn't hurt. It's like kind of similar to brushing your teeth. They just scrape like deeper than you can get with a toothbrush. But yeah, I didn't believe her at first. I was like, no way, because if she didn't have cavities, she would be bragging about that, right? She would be like, I went in and had no cavities, and they just wanted to do a deep cleaning because, I haven't been to the dentist in forever, something like that. But no, she talks about this deep cleaning that she went to get, and they numbed her whole mouth. It was like 12 shots. I'm going to let you listen to a little more of what she says, but it's really, really concerning what happened to her. And I don't think this is necessarily all, from the anesthesia, whatever these shots are they gave her.
Up and down my body, and then my mouth actually went numb. My whole mouth and my jaw went numb, and my tongue actually swelled up, and I just had numbing in my whole entire jaw. Like, so this is after the dentist. It numbed again. So my jaw and my lips and everything, I couldn't feel them, and I was biting on my tongue, and it was terrible, for days. And I was also getting these pains, like my body was re-experiencing the injections, like at the injection sites. It's like someone was pressing hard on the injection sites, like someone's hand. Creepy as fuck, like really, really creepy. And whenever I closed my eyes, I would get just racing thoughts. Like a thought would come, and then another one would come and replace it and replace it and replace it, and then all of a sudden it'd be all black. There'd be absolutely nothing at all, and then there'd be flashes, and extremely scary. And one of the most scary things was this involuntary jaw clenching but smashing together. My upper and lower jaw were smashing together. I thought I was going to break my teeth. So I couldn't control it.
For some reason, the volume on this was very, very low. I had to put it in editing and turn it up as far as it would go here, so it sounds normal. I think she did this so she knows. She watches Shar's channel. She knows people are going to be talking about this, I think. So also keep in mind, this was the monsoon season, right? This was what she said. It was the rainy season. She couldn't record. So she lied. She admits basically that she lied, and that's why she wasn't coming on camera. But I don't know, like, why does she feel like she has something to hide? Why not just say she had this emergency, bizarre thing at the dentist, and now she can't get on camera because her mouth, she's dealing with something. And then she comes on and says all of this happened. And a lot of what she's talking about here sounds like PTSD, like she was very traumatized from that procedure. I think she had an anxiety attack in the chair. She felt like her heart was beating out of her chest. She wanted them to stop. She thinks they gave her too much, and talks about how clean her body is, and so she probably couldn't handle it because of that. And I was thinking, why is she even telling any of this? She likes to hide this sort of thing. I think she finally has something to blame it on. And it reminded me something Juliet Autumn said, that she was talking about like food porn and whatnot, that it might be a cry for help. I think maybe this is what she wants to come out and talk about, these issues she's having. I don't think this is the first issue, you know what I mean? I think she's been experiencing things, and now she has something to say. This is what caused it. This is what's causing it. You know, she can't sleep. This is about 2 weeks later after this anesthesia, local anesthetic in her mouth, and this is not the kind of anesthesia that makes you go to sleep, so it's not very intense. It's just a numbing, like lidocaine. I don't know. Maybe it's worse than lidocaine. I'm not sure what they use in Ecuador. But I want you to listen to more of these symptoms because they're very extreme and intense. She's waking up at night. She can't sleep. Her legs are going numb. Her whole face is going numb. You know, she's having a lot of intense feelings that are not just anxiety, not just PTSD, not, you know what I mean? There's something going on in her body. And my conclusion would be, or my assumption would be, when you have any sort of medication, especially if it's strong, your body needs to eliminate that, and your body needs to be healthy and have enough nutrients and minerals and whatever it needs to detox. This is why you look at like meth heads and people that have been on hard drugs. They look like they've been malnourished for years and years and years. And what it is, not only are they not eating properly while they're on these drugs, specifically with meth, I think that's amphetamine, yeah. The body needs to eliminate it. And so every time it's trying to eliminate it and they're putting more and more in, their body is depleting everything it has possibly to get rid of this drug, right? And so it has nothing left. There's just nothing left. So you'll see the big sores all over the person and like the sunken eyes and just, you know, the pale skin. They have all of the teeth rotten out, you know. So I do think this was a huge shock on her body. I don't think it's because she's so clean. I think it's because she's so depleted.
I got an adrenaline hit to wake up, you know, probably because I've gone through this trauma in the chair where my brain was like, we're going to die here, you're going to have a cardiac arrest, and also the side effects from these drugs, from too much, you know, from getting, you know, not quadrants done, you know. So anyway, next day just felt weird, very, very strange. And I should say during that time when I couldn't sleep, I was having trouble feeling my legs as well. They just went numb. It was very, very odd. And so the next day, I started to feel just strange all day, and I had to lie down, had to try to sleep, which was very difficult. You know, my body wouldn't go into an REM sleep, like a deep sleep, because the adrenaline kept hitting every time. And then when I got to nighttime, I was like, oh gosh, here we go. I don't know how this is going to be. And it's not about panic attack. You have to realize this is not anything to do with panic attack. I had that in my past, all right? This is not it, okay? This is a side effect from the drug and also trauma from the experience. So when I got to nighttime, and I'm relaxing, you know, I'm feeling okay, I can do this, I'm going to relax, I'm going to sleep. And just as I'm about to doze off, bang, this like cardiac arrest.
I had to freeze it right there just to be funny. No, this isn't funny, but she called the dentist, and the dentist blamed her. He probably just thinks she's neurotic, and you know what I mean? So he's never heard of this before. Usually this local anesthesia goes away. He never hears back from the patient when they have something like this. And keep in mind, he's doing her a favor because she's got gum disease probably. And probably all kind of cavities that had to be filled, you know, during, and that's probably why he did the entire mouth. I don't know. Maybe this is how Ecuadorian doctors or dentists operate. But I would assume they probably had to do a lot more work. They had to do a deep cleaning inside of the gums to get rid of that disease, and then they had to fill a bunch of cavities. I actually feel sorry for her watching this because I'm thinking she wants to be honest. She wants to tell us, like, what is really going on with her. This is weeks. Again, this is weeks after a local anesthetic. This is not something you go to sleep and it has to, like, if you've ever been put to sleep or had any kind of medication like that, you know, I think I can remember waking up in the night with, like, feeling my body sweating, trying to eliminate it. But I could go back to sleep and it was fine. You feel basically normal. It's just your body, you know, has its own way of flushing things out. But with her, she's going on weeks with a local anesthetic, still can't get this out of her system properly, or it has, and now she's just experienced, maybe it like triggered the fact that she just doesn't have iron and all these other nutrients, and now she's having, you know, waking up in the night. That reminds me of anemia right there. And then with the legs, I don't know. It's probably a multitude of different nutrients that she's lacking. And I can guarantee you, if she would eat some eggs and milk and red meat, I bet she would immediately feel better. But she won't do this. She won't do it. Snow pea won't make her. And look at her fingertips. They're freaking red, just like around her mouth. I don't know. I don't know what to say. I just thought we'd talk about this. All right. Y'all have a blessed day.